If you lost your job and your health insurance this year, listen up. Today is the last day of open enrollment for the Affordable Care Act in most states. You can enroll on the website healthcare.gov. People working to enroll Americans on that site are telling NBC News that they are worried that in the middle of a pandemic and an economic crisis, that this program's benefits are just not reaching enough people who need help. NBC News policy editor Benjy Sarlin joins me now. Benjy, more than 10 million Americans have lost their jobs since the start of the pandemic. That means millions of Americans lost access to employer-backed health insurance. You're reporting that help from the ACA might not be getting to the people who need it. Why not? What's going on here?
Well, one of the biggest obstacles we're hearing from people who are trying to enroll people right now is that they just might not be aware that they're eligible for these kinds of benefits because so many new people might have lost their employer insurance this year during the pandemic or potentially become eligible for subsidized health care that they didn't have access to before because their income declined. They might not be familiar with the program, and making things a little more difficult under President Trump, marketing and outreach to try to inform people about enrollment has gone down significantly. In fact, they cut the marketing budget by 90% from where it was under President Obama. They've also cut the funding for what was called the Navigator program, which is basically customer service to try to help assist people with the process. This is also a problem. I talked to one private insurance broker who works with clients who are signed up for the Affordable Care Act, who said some people were intimidated by the process because they hadn't gone through it before and they weren't quite sure how to predict their income over the next year because of all the uncertainty around the pandemic. And they could definitely use more assistance in guiding them through the process. They're worried too many people will be left behind. So in general, there's a concern that even though in some ways the law has never been more important, it seemed to be almost tailor-made for a situation where millions of people were losing their work-based insurance. It might just not reach all the people who could benefit.
So, Benjy, what do we know about how many Americans have been taking advantage of these benefits up until now? Do we have any sense of what actual enrollment has been like this year?
Now, we do not know the total number of people who are enrolled. We don't know how many people lost their insurance earlier in the pandemic and signed up for an ACA plan, either temporarily or still have one. We do know that enrollment is up slightly this year versus the same time last year during this open enrollment period. So it does suggest there is demand for it. But it's still not exactly clear how many people are taking advantage of it. There are some signs that enrollment might be up overall. There was a study recently by the Kaiser Family Foundation that found that the amount of people going without insurance may actually have not gone up as much as you might have expected during the pandemic, even though millions and millions of people were losing their jobs, at least temporarily. And part of the reason could be that a significant number were able to enroll in either a private plan or Medicaid through the Affordable Care Act. So that's one possibility. But we still don't really know the exact numbers.
So if our viewers are sitting here thinking, oh my God, I had no idea it was the end of open enrollment, I could use health insurance, what should they know about their options and how to enroll? How can we best help in this 11th hour, if you will?
Well, you still have time. You have the rest of the night, but you should really jump in quickly if you're interested. You go to healthcare.gov, which is the federal portal site that will guide you. Put in what state you're in. It'll guide you to the right application. And then it's fairly simple. You put in some basic personal information. You put in your age. You put in what you think your income will be the next year. And you can take your best guess, and it will show you what plans are available in your area and how much you could get in terms of help from the government to pay for them. Depending on your income, you might qualify for significant tax credits. In many cases, so many that you might have a free healthcare option, that there might even be a private insurance option, likely with a high deductible, that still comes at no cost. While there aren't necessarily a lot of insurers in every place, sometimes there's only one, there are different tiers of options. There are plans with higher deductibles or lower deductibles, depending on the premium that you can choose from. So definitely shop around.
Benjy, really important advice and a great reminder for so many people who might not have known this deadline was coming. Thank you for being on with us today.
Thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.